Well, we have an hour to really be before your lunch, and so we're going to try and really make it exciting for you and challenge you a bit. As you've heard, we've got a fairly diverse panel, and we're really looking at the whole issue of how do we integrate nutrition into human and animal health, and perhaps more broadly looking at the linkage between agriculture, health, and nutrition. But before turning to the panel members to give you some of their views, what we're really looking for here is really following the theme of this meeting. What are some of those new models that can build this integration? We know how difficult it is when we're sitting down with the agriculture sector and the health sector. They're totally different cultures. They rarely come together. But we see today that given the challenges around food and nutrition security, there's a new openness to start to look at how do we integrate nutrition all along the value chain? And what are some of those new models and what are some of those new partnerships that can drive this? So those are the things that we're going to try and tease out over this session. And with that, I'm going to turn first to the minister and ask her, given all your experience globally as well as in Liberia, how do you see this integration happening? And we know one of your most exciting programs has been this Elimination of Hunger initiative, which focuses very much on women at the center of this. Maybe you can share with us some of your experiences.
Thank you very much. You are right about our focus in Liberia on women. Why? Because the Liberian farmer, she is a woman. But one of my closest collaborators is the Minister of Health. Because we both realize that something that goes wrong in agriculture can very quickly become a health problem. We also have no problem looking at human and animal health and nutrition together, because for our farmers, they are one, they go together. And so we start first with the policy. As we talk about Liberia, which, if you do the math, we are 165 years of independence. But I want you to think not of 165 years, of starting in 2006, where we literally started from scratch to rebuild a country after 26 years of total destruction. Food and nutrition, of course, is high on our list, was when we started, will continue to be, because a quick assessment told us that food insecurity at the time was about 55%. But on top of that, we could see the nutritional problems that we had with our children, because you could see so many of them stunted. We have done the assessment with WHO, UNICEF. Our figure of stunting, not malnutrition only, just stunting, is 41.8%. From all of those years of being deprived of food and nutrition. And so we put the emphasis on developing the policy to deal with that bundle of problems. And I can tell you all of those years of international work, all of those years of being trained here in the US, in Wisconsin, all of those years of just observing, listening, we have had to use every bit of it to carve out what is the policy direction for us. It starts first and foremost with ownership. We determine that since we are starting from scratch, we will own our own agenda. So we drive it. It is not driven for us. And on that agenda, for food and nutrition, we look at both food crops, but as I said, animals as equally as important, animal health, because for us, they go together. And so we spend time putting the policy in place. And that policy has nutrition for both at the center.
Thank you. Let me turn to Jim Gerdot from Novus International. Jim, your company produces so many of the key products for animal nutrition, and as somebody who's leading an international organization working on human nutrition, all the things that you're doing for animals, we're struggling to do with humans. And I look at some of the products from probiotics to essential fatty acids to key minerals to antioxidants. How do you see us moving from the success around animal nutrition into human nutrition? Do you see possibilities to link the two?
Yeah, Mark, great question. I think when we look fundamentally, some of the people that are the most interesting in kind of understanding this is what I would call the farm kids. Myself and my wife, for example, we're from farms in Indiana. And Rhonda's in the audience today, but she's always challenging, trying to bring the human nutrition element in to what's done. And some of our childhood memories are around canning fruits and vegetables, quality production of beef, even for the neighbors, ourselves, the communities, and making sure that's done in a very good and solid, sustainable way. And trying to bring that to the equation and try to bring it to what we've heard today on the stage and all week, really, to feed the world affordable, wholesome food is where Novus's vision kind of intersects with that. The neat thing is that there's a lot of farm kids like myself in Novus, and we have a vision to really execute this, not just talk about it. And so one of the things we found most important in the process of executing it is really understanding you can't do it alone. You know, that farm kids need a lot of different people involved in helping them to develop technologies to bring those to bear. So we understand that. So Novus found that the best way that it can bring that to life as a company is to be a catalyst, is not to just sit and stay idle with its knowledge of nutritional products and its knowledge of production, but to bring people to bear. So I wanted to give you an example. In 2009, Novus went to Alagoas, Brazil, and this was an area of some poverty, people who really wanted to improve their quality of life, but didn't have all the answers to be able to do that. And we just heard from the last panel, and Jeff, I love his get out of the bubble, was to try to bring to bear on the community a way that they could integrate animal protein into their own area sustainably and be a part of that. So Global Aves was one of our customers, and they had some really great technology in poultry production. They had chicks available, so we said, what if we just take some of those technologies and understanding to local farmers who aren't producing poultry and talk to them about the benefits of poultry protein, easy to grow, very economical, use our technology to show how to grow it, and use the local community, the governments locally, to try to get involved in a sustainable value chain, because what we're talking about is value added. So it's got to be sustainable. So we got them involved in the fact that if we were to be able to set up this chain locally, and they were able to put the product into what they decided to do is put it into the school lunch program in the community, we could make a full loop. So the local government decided to buy the poultry from poultry raisers. We helped them to raise that, and we closed that loop in Alagoas. And a month ago, it was so exciting to see the families come to us at the WPA and say, you really have changed our lives. You know, because you didn't just provide the fish, you taught us how to fish, and now we've got a closed system. So one of the models we're trying to promote and really put into play in a very workable and very effective manner is that closed value chain, and trying to bring to bear local governments, regional authorities, school systems, build the markets, our customers, and the whole chain, you know, to make that happen. So that's just one of several, and we've actually been able to now, we've announced the scale up of that project in Chad. It'll be a $50 million project from the broiler chicken all the way to the processing plant to help sustainable protein in Chad to be developed as a footprint. And in 2 weeks ago, talking with some of the U.S. commerce officials, they're now interested in going to miniaturized state in Brazil and using some of our resources in the U.S. to scale a similar project in that area. So, you know, not all projects fit all sizes, but when you start the process of trying and getting involved and being a catalyst and bringing all the people that can give the experience and knowledge to bear, I think that's where you hit a pretty nice sweet spot.
Great, thank you. Let me turn to Mehmood Khan from PepsiCo. I mean, for the last few years, PepsiCo has been investing quite heavily in bringing nutrition into all its food and beverage brands, and also leveraging its supply chain for quite interesting ways. Can you share with us some of your experiences?
Well, I think, as has already been said and you pointed out, first of all, there's no one solution. Okay, and secondly, I don't believe any one company, any one government, or any one nonprofit is going to find the answer. I think it's going to be how we all work together, and let me share some examples of how we came about it. And some of the solutions actually are not what you intuitively would come to. Let's give the example of, start with Africa. We've looked at our capabilities in agro, our ability to scale production, distribution, production of the final product, because most consumers don't consume a commodity. They consume a finished food. And there's a difference between food that's been cooked or processed versus a commodity. And I think what we sometimes forget is just because we grow it doesn't mean to say that it's actually going to get in the hands of the consumer. We've been focused on that. And we went into Ethiopia. We're working with the Ethiopian government to look at chickpea as a commodity that grows but ultimately becomes a final product that we can distribute. It's very difficult to distribute raw commodities. The other is, we've learned over the years that other than the extreme poverty where you have people who are starving, the majority of the world's population that is hungry has some disposable income. They just don't have enough to meet their needs. However, as humans, and the difference between the animal business and the human business, humans will exert a choice. And we have to find ways of making whatever we make both nourishing but also aspirational. If it doesn't taste good, if they don't enjoy it, in particular the children and the adolescents that need it most will reject that product once they have the ability to make a choice. So bringing in our knowledge of expertise around consumer choice, taste, texture, aroma, and preserving that in a fashion that keeps the nourishment is important. The last is one that's really, for me, has been one of the most fun projects. We looked at this and we asked a question. A lot of what we've talked about even this week has been about increasing the use of fruits, vegetables, eggs, meat, etc. But there's a logistical problem here. It's great to produce an egg, to produce fresh vegetables, but by the time you've transported that fresh produce to the consumer, and it's not harvested on a weekly basis or a daily basis. I mean, we all hear the famous story of a mango crop that comes out 4 weeks a year, and the other 48 weeks, it rots, and there is no food supply in terms of that fruit. Refrigeration is critical. Processing technology is critical. Both are capital intensive and expensive. Let me give you one example of how we looked at approaching this. I asked a team of engineers, I said, look, a typical refrigerator costs somewhere between $500 to $600 if we talk about what's in the shopkeeper. The cheapest, if you go to the developing world, you can bring it down to $400. I asked the engineering team, we put an engineering team together, I said, look, if the world can produce a $2,000 car in India, why is it we can't produce a fridge that costs less than 500 bucks? Well, the answer I got from my usual engineering, we have a lot of engineers at PepsiCo. Fortunately, they all report to me. I called them in, and the humor of the old man, and I said, look, I want a cooler that costs 200 bucks. My senior-most engineers threw their arms up and said, Mehmood, have you any idea how much a compressor costs? The lowest cost compressor from China is $250. How are you going to make a $200 cooler? So we set about it a year ago. I can tell you we've just put into market for beta testing a $180 cooler. Okay? It's not pretty. It's not scale. It doesn't have all the bells and whistles, but it drops the temperature from the ambient down by about 20 degrees centigrade. That's enough to give me shelf life for dairy, for perishables. It doesn't give me a month, it doesn't give me 3 months, but the time to look at the cycle of distribution, it's important. So these are examples. By the way, that one didn't come from the refrigeration engineers. It came from electrical engineers with no moving parts, no compressor. So we can get into a detail, but my point is, unless you create the vision, the direction, and look in areas which you haven't traditionally looked, which means partnerships, you're not going to solve this equation.
Just come back on one thing. You know, many of the players who work in the nutrition space often say, you know, they're a little confused when they look at a company like PepsiCo or other of your competitors, and why they're not able to provide more nutritious products at the base of the pyramid. And the answer that often comes back is too expensive. You can't recover the cost of nutrition by providing these products at the base of the pyramid. I mean, just use your cooler example. I mean, where are we in getting these affordable, high-quality nutrition products? Because I know, you know, as we've said earlier, more and more people are going to be living in cities. More and more people are going to be consuming industrial foods. How do we get those products to those people?
Well, we're going to have to think of this two different ways. One is, look, a lot of discussion goes on about rural poverty, and you've touched on one that I'm particularly interested in. 50% of the world's population lives in cities. By the year somewhere around 2050, 2/3 will. Ironically, it's a developing world issue. By that time, of the 25 to 30 megacities in the world, 2 will be in the developed world, and the other 20 plus will be in the developing world. And in that developing world, with a 20 million population in that city, getting food from farming communities into the middle of that city where these people who are hungry live, it is not going to be by organic farms. It is not going to be by local farming. You have, on average, 200 to 300 miles of distance between the producer and the consumer. And unless we figure out cheap production, the right agro crops, which means that governments have to align, the right way of distributing it, we cannot use our usual methodology. A 16-wheel truck is not going to go through the downtown area of Sao Paulo, Mumbai, Shanghai, and get into those little communities. Or Manhattan, for that matter. You cannot. Anybody try driving in Manhattan? Try a 16-wheel truck delivering your groceries. It doesn't work that way. So we need to, which is why I've become particularly interested in leveraging our expertise to say, this is going to be a new equation, new scale, but I'll end by saying it starts with, are we growing the right stuff? And that's with the governments. It's with the ministers of agriculture talking to the ministers of health, because when a ministry of agriculture is incentivizing one type of crop, and the minister of health is saying, no, we ought to be eating something different, the first thing I do when I go to Washington is say, how come you two aren't talking? Because I, as a food producer, will produce ultimately what the commodities that are grown, which in turn is what the governments are incentivizing farmers to grow. We can get into that in more detail another time.
Thank you. Jeff Richardson, the Abbott Fund has done some really innovative things. I mean, one project that I'm very aware of is the Haiti project, where with a number of partners you're producing therapeutic or supporting the production of therapeutic foods, relying on the local value chain. Can you tell us a bit about that model and what you've learned from it?
Sure, thank you. Again, I'm with the Abbott Fund, which is the philanthropic arm of Abbott Laboratories. And I oversee the international giving programs, primarily nutrition, HIV, AIDS, and neglected tropical diseases. In this particular instance, we have a great partnership with Partners in Health and Zamni La Santé, the local NGO that works closely with Partners in Health in Haiti, also with TechnoServe and getting some technical advice from FSG, a Boston-based consulting company. And what we're trying to do here is to produce the RUTF for malnourished children in the Partners in Health catchment area. About 1.5 million people are in that central plateau area in Haiti. But what's different about producing and scaling up their current production of what they call Nuri Mamba, we're also going to build the plant in such a way that they'll be able to make peanut butter, and that the profits from the sale of the peanut butter will sustain the Nuri Mamba, which will always be distributed for free. So we're looking at those kinds of models where we can actually build in sustainability to this project. Now, this is a very hot topic in my world, in the philanthropy world. In fact, at the last couple of global philanthropy forums, this intersection between social enterprise and philanthropy has been the top of the agenda. And so I say with great enthusiasm what we're doing with Partners in Health, but I also say with some humility, it's still a work in progress. And so we'll see how the commercial piece of this works out. We know how to build nutrition plants. That plant will be completed by the end of the year. It's over a $4 million investment. We have a number of people working with us from Abbott, which is also new and which is also a very hot topic in the philanthropic world. We're looking at bringing in more and more people in more of our projects, but specifically in Haiti, we're working with our Abbott nutrition scientists. We're working with Abbott engineers who've actually overseen the building of this 18,000 square foot plant. We're working with global purchasing people from Abbott, which are helping to secure different products as well as equipment for the plant, and with Abbott marketing folks who are going to help us design and develop this commercial plan. We're doing a similar kind of work with PATH in India on a fortified rice project. We're also working with Project Hope at the Shanghai Children's Hospital and with Boston University School of Medicine, with Bach Mai Hospital, the National Institute of Nutrition, and the University of Medical College in Hanoi on also a nutrition project that's basically saying food is medicine and institutionalizing good nutritious meals in hospital settings as part of the overall offering of services, if you will, at the hospital. So there's a lot more to talk about, but we are looking at new and innovative ways to advance the nutrition agenda, and where appropriate, bringing in our core competencies from Abbott as well as our dollars from the Abbott Fund.
Thank you very much. I think if we look at how we're going to feed billions of people, address very difficult challenges like malnutrition, stunting, underweight, we really need to start to look at what are some of these new integrative models. And I really want to turn to the focus on asking the panel members, what are the best bets in terms of these models? And what do we need to have in place to make them work? We need to go to scale. We're not looking at boutique projects here. We need scale. So what are those models? And what needs to be in place? Is it new partnership platforms? Is it concessional financing? Is it new technology partnerships? I was at an event at the Prime Minister of the UK held at the end of the Olympics, where you had many players committing to a new R&D platform. Is that what we need to, in a pre-competitive way, not with a number of companies coming together? Or is it a big focus on the regulatory and policy environment? You know, what are the things that are preventing us from getting these models going, and what do we have to start to build? There's a lot of great examples in the global health area that haven't yet really been applied in the food and agriculture area. where we've created many vehicles that have been extremely successful. And maybe we have to start to look to some of those. So let me first start with you, Honorable Minister.
Well, as I said before, in fact, I like the topic, integrating health. So all of the things you mentioned, we need to do them. We definitely need to scale up. We're not going to feed the expanding population doing business as usual in many of these places where the hungry are, in fact, the number of hungry are growing. So you have to scale up. I agree with that. But you also need to have the policies and the regulations in place. So all that you mentioned, one needs to do. Governments have to be involved. Governments have to encourage partnership. But one thing I'd like to point out that part of that partnership have to be the people themselves. We're not going to do it and talk about sustainability if we are going to build around a system that will do it for people, that will give all of these things to people free. We're not going to get there. Sustainability, giving free, shouldn't be in the same sentence. So even though, I like your idea that people have something to bring to the table. They have some resources to bring. Let's look at integrating the nutrition. And let's look at the model we are using of feeding children at home, the under fives, and at school. Working with the World Food Program as a partner, working with the government as a partner, working with the mothers, the farmers as partners, everybody trying to do theirs. The farmer is involved in an education program that teaches her about nutrition. It's supported by both agriculture and health. So she is involved, or the family is involved in growing those crops, for example, that will go into the school feeding, but also be used. Health with their nutrition people are teaching them, how to use the product. And it's a win-win for everyone. So it has to be, why is it working? Because it's part of a policy direction, and then you put the regulations in place. Some regulations require, some areas require regulations that have to even be ratified and made into law. But not all of them do. Scaling up, you must do. In many places, the movement of products from one point to the other, and I love your story about the refrigeration, because in areas like ours where you have long distances in between, you have roads that become impassable, and even if you are able to pass, as he said, the shelf life of the product deteriorates. So the model that we are using is, at this point in time, is to localize some of those processing, production. Your example of the poultry is one that we are using also. Localize it, get things moving, and then expand it. Or do I know about the urbanization? 1/3 of Liberians live in the capital city alone. And so you do have to face up to this problem of urbanization. But it's just bringing everybody to the table, making them feel that they are partners, and the public-private relationship has worked. We only are looking for more opportunities for this kind of relationship, because that's what you need for the scaling up.
Is this a model that we can replicate in other countries in Africa or elsewhere?
Well, as I said in the beginning, it has worked for us. We have been able to drop our undernutrition or malnutrition from 53% to now 41%. We're able to feed our children in 1,800 schools, totally on locally produced, product. And who's doing it? The small farmers. It has a partnership with government. We buy the products from the farmers. We work with them on training them skill for food production, and then we buy it from them. But that woman is also involved in adult education. So now in 6 years, 7 years, she can read and she can write her name, she can sign her name, she has a bank account. She can understand the money transfer because it's all by telephone. And she knows how to, so it's education, is the health, it's the nutrition, it's the package coming together as one.
Right. Let me turn to you, Jim. What do you see as the best bet if we really wanted to focus more on?
Just to build on Her Excellency's comments, I think the best bets are those where the local needs really clearly identified, because in some cases, supply chains are pretty well developed, and in other cases, they're very underdeveloped. So what we try to do in our best bets have been by understanding that local need and situation, then getting that collaboration around what you're trying to achieve first, set the objective, and then find out holistically how you're going to be able to pull it all together so all the pieces of the puzzle will fit and work. If there's one missing, that's where you get the challenge. So in some cases, we have a big challenge because the finance piece is missing, where we haven't found the right group to sell in to support the financial infrastructure. In some cases, the technology piece is missing. We don't have the experts, so we have to go out and reach out and find them. But once we kind of establish and set the local objective of what we're trying to achieve, and then we can be the catalyst to identify those components where we need to bring into the discussion. We start to find all the elements. It may take time. As we're scaling up our CHAD project, it took 2.5 years to get that collaboration. It'll take another 3 to 5 years to finish the project. So you have to be consistent, you have to be tenacious, and you have to sell a lot of people. And that's what I like about the World Food Prize environment. As we go out, think about the people that you can bring in the process, find the objective, pull it together in a group, and sell everyone to collaborate. And we sometimes miss the fact that that's not always easy, but definitely what we're finding is the most appropriate way to get the best results from whatever footprint we try to scale. So those component pieces need to be into play, but always start, at that stage of what is the objective for that local situation you're trying to achieve, actually.
Thank you. I think the time issue is really an important one. I think certainly with the programs that we've financed over the last 10 years, we've found that a lot of these programs to get to scale, and they reach over 600 million people today, it's taken 8 years to get to scale. But for the private sector, 8 years is a lifetime. They're often looking to make a profit on a brand or a product in 18 months. Mehmood, could you tell us a bit about, how do you look at time to get some of these achievements underway, and how do you make these business models work?
Well, I think your comment about the private sector and the pressure to get a return on investment in a relatively short time is partly true. I think that's true for a division or an operating business from that business unit point of view. But the role of corporate and the role of the corporation and the senior leadership is to think strategically much further out. And I can give you several examples of that. For example, when we looked at growing our business in China, 10 years before we had a business, we were teaching farmers in Mongolia how to do drip irrigation, create the farming capability, create the supply chain for a future business that we were going to actually launch the businesses on the eastern part of China, Shanghai, all the coast. That didn't happen in a year. That was a decade. But knowing that this was a growth area, it strategically was very necessary. Same in South Asia. A lot of attention now to Africa for the same reason. Africa's going through rapid transformation. And companies that have the foresight to look at this have done this repeatedly. But let me add two points that I think often are forgotten. One is, this is not just about growing more food. The best estimates out there say the world's population gets to 9 billion, we'll have added somewhere around 20 to 30% more people. Okay? If we do this and we continue our current ratio, we're going to have to increase food production by about 50%. The planet can't produce another 50% of food. Okay, so we're going to have two choices. Either use more of the food we're already producing, or starve this planet out of its resources, and we won't have that capacity. I don't care where we are. So one is, we're going to have to find efficiency in what we do, which means our usual way of doing things aren't possible. And then second, the economic challenges that are going on, not only in the developing world, but in the developed world. Take a look at Europe, take a look at the average person. There's 50 million Americans on food stamps. What are we going to do that keeps our products at a price range that is accessible? So accessibility is not just physical accessibility, but financial accessibility. At the same time, allow businesses to continue to have the profits to be able to invest to get the innovations like the examples I just gave. You know what? That's going to take a whole lot of different thinking. One of the things I'm doing as the chief scientist at our company is say, which other industries do I bring into PepsiCo? You know, it's a crazy notion. Here's a physician, a practicing physician, sitting as the head of R&D of PepsiCo. And yet I go to food meetings, and a lot of meetings, and I say, I wonder how many people in this audience have got a background in health. It's very rare. And I ask myself, why? Aren't we talking about human health? So I think there's an opportunity here to really bring disciplines together, and I think you'll have great ideas. The bottom line is, it can't be old, expensive ways of doing things. Cannot be sustained.
How do you bring those groups together? I mean, one of the early programs that Gain did 7 years ago was putting a health person in the middle of NEPAD to try and bring health into CADEP. It was very hard to sit down with agriculture permanent secretaries in Africa for many years. Now it's changing, but health was not on the top 50 of their priorities. They say go talk to the Minister of Health. But also in the private sector, you don't see this. You're a bit of an anomaly. How do we create this culture more that allows for this integration of disciplines?
I think as leaders, we set the precedent. My boss, Indra Nui, was having a conversation with Steve Jobs before he passed away a couple of years back, and asked, this was a dialogue around what was important. And there was a question on which parts of the organization were important to any leader, and the first question Steve Jobs said was, does that function report to you directly? And if the answer is no, it's not important to you. The answer is yes, as a leader, it's important to you. So one of the things I take out of that from a very insightful business leader is I look around my organization and say, which parts of my organization should be immediately reporting into me? If they're really that important strategically, I'll do that. And that does two things. One is it puts it on your radar screen. The other, it sets a very strong message to your organization, whether you're a for-profit or not-for-profit, of what is important to you as a leader. How about we start there? As leaders, we ask ourselves, who do we surround ourselves with, and do we have the share of voice that we need? All too often, we espouse something is important, and then when you look at a leader's executive staff, you sort of see this gap. And you wonder, I wonder how important that really is.
Thank you. Jeff, I wanted to turn to you. Many people think philanthropy could play a much bigger role in picking up the risk of introducing a lot of these new technologies, a lot of new business plans where the market's not prepared to cover the risk. Do you see philanthropy playing that role? I mean, do you see de-risking more something that can help move us along with some of these models?
Yeah, I do. And I think just to build on the last point, when I was brought on to the Abbott Fund, prior to that, from 1951 to basically 99, all of our giving was domestic and primarily in the Chicago area. And so when the new CEO came on, Miles White, earlier in the year, he basically said, I want to globalize not only the business but also the Abbott Fund. And so that's when we started our international work. So the leadership piece is key there. But we have gotten a really broad mandate to do exactly what you're saying, to take risks. And so, for example, when we started with AIDS was our primary focus early on with the Baylor International Pediatric AIDS Initiative. We opened the first clinic ever with them in Romania, which some of you may know was the only country in the world that had more children with HIV than adults. And there's a longer story behind that, but that was the reason Baylor started there. That program now is has 8 clinics in 7 countries and serving over 125,000 children and young people who are living with HIV and AIDS. And I'm happy to say that I went back for the 10th year anniversary in Constanța, Romania, where the clinic was, and I was surrounded by now a lot of young people who have families and jobs or in college and that type of thing. And that's part of what needs to be done. Foundations, and I would say companies, when you're, back to your point, Mark, when you're in this, you have to commit to be in it for the long haul. We are still the largest, our largest grantee, I should say, is Baylor College of Medicine, but because of all their great work now, we're less than 15% of their overall budget, and so we made that commitment. I think, and there's other examples of that. We went into Tanzania with a very small project on AIDS orphans and vulnerable children. Now, 11 years later, we've invested more than $100 million in Tanzania in helping build up their healthcare infrastructure and systems because of that experience. Again, we now have a 20-person office in Dar es Salaam, more people than we have in Abbott Park, Illinois. So if we have a good connection, we're making a difference, we have measurable results, we can do, I think, remarkable things. And I mentioned the Haiti project before. We just dove in the deep end of the water here. We're not sure how it's going to work out, but we've had that kind of permission, if you will, from leadership at Abbott and within the Abbott Fund to do just that. Let me just say, and I know we want to get to questions too, but if I can quote my late father, one of the things that he said that I think also resonates with a lot of my fellow donors and grantees, it's amazing how much you can accomplish if you don't care who gets the credit. And you know, that is really essential when you're doing this kind of work, is just get the work done. You know, Abbott is, it always, I got choked up thinking about my dad, sorry. So, what's amazing to me, oftentimes I have people say, why doesn't Abbott talk about what they're doing? And you know, and I just feel that all too often, we're very proud of what we do, and I do it at these kind of forums, and we, you know, I'm glad to talk with anyone, anytime about it, but I do think there's so much emphasis on the public relations piece of the work, and whose name is on the building, and all of these kinds of things. So I just think if people can get into this work and look at, again, what are we trying to accomplish, what kind of impact we're doing, and also know that failing is also can be a positive thing. We can learn from that, and we can actually do this. And I can say again, with this whole Haiti project, this whole commercial piece might go belly up. I hope it doesn't, of course, because we're very enthused and excited about it, but I'm so proud of Abbott and the Abbott Fund for doing it, and knowing, not knowing, you know, what the outcome might be. And so I think that's also key to success. So first, to your point, being in for the long haul, but also taking risks. And I think at the fund, and I know a lot of my fellow philanthropists, if you will, also have that kind of permission to do that. And so in many ways, we can be a catalyst for change.
Thank you. And that was a great comment. I'm going to turn to the floor for questions, and while people are thinking about their questions, I'm going to ask the minister one other question, because many people who look at a lot of these models which are focusing on markets and say, well, that's great, but a lot of the people you're trying to reach aren't in the market. They're too poor to be in the market. They're not consumers yet, and they're learning less than $1 a day, and they're barely hanging on. So what's your model offer for these people? And Minister, you said part of the new model in Liberia was to have rations go in the home and a big investment on school feeding. So, that to me implies we need subsidies of some kind, or does it mean that we can build these into the models to reach those people?
There are no rations going into the homes. The farmers are paid a fair market price, and so they have some buying power. But the farmers also retain part of their production for home consumption. What goes into the school is part of the school feeding program. 1 hot meal a day or something. So now that I cleared that, there are no subsidies to the farmers. When we take their product away, we pay them cash. At source, in fact.
So is there no need for subsidies?
There are needs for inputs. Mm-hmm. Now, we do not have the means to provide the subsidy that we need to provide. If we did, we would be subsidizing the inputs to increase the production level. But when we provide the first planting material, because 7 years ago, nobody had planting material. We started off, if you can imagine, with a country that had no seeds to plant, no germplasm, no animal life. Over 26 years, anything that moved became dinner. So there were no animal life. So we have had to restock. We have had to multiply, bring in seeds, multiply them to get to the point where we are now with our major staple rice. We're self-sufficient in seed production. So those seeds are not given the first time to a farmer, thereafter to a very small farmer, thereafter 20% payback on the seeds so that we can share it with another farmer.
Well, I see a long lineup for questions there. We have a little over about 10 minutes. So I think what I'm going to just ask, those people are already standing up to just say their question really quickly, and then the panel can respond to all the questions at once. But we're going to have to be really short given all the people, so please. And maybe introduce yourself.
Hello, my name is Dr. Felicitas Madziwa. I am a physician. And my question is for Dr. Mehmood. I would want to know, because as a physician, when I look at food, I'm looking at it as energy as well as the information at the cellular level and how it's going to impact our health. How are we going to bridge the gap between massive production of food to feed the whole world, and at the same time maintaining the health that we need as human beings in order for us to progress?
Well, I wish I had the answer.
Wait, Mehmood, I'm just going to take all of them and then we'll do them together. Yeah, sorry. Otherwise, we won't get through them all. Sorry.
Hi, Sarah Delaney. I'm with Episcopal Relief and Development. Mehmood, you mentioned with a growing population, particularly a growing urban population, that we need to be growing the right stuff. Just curious if you could elaborate in your review what that is and why, or if anyone else has an opinion on that.
Question from the back. Question for Dr. Khan. I applaud your development of this low-cost refrigerator. Very exciting news. I'd be interested in your thoughts on how do you see, presuming the beta trials are successful, How do you see scaling this, partnering to actually get manufacturing and distribution throughout the world? And secondly, is this technology also amenable to scaling for producer wholesale capacity cooling chains? Thank you.
I think I'm going to stop after this next one, because but
Craig,
they're all for you, so it should be easy.
I'm Craig McKenzie from New Zealand. I'm a farmer from New Zealand. I'm here as part of the Global Farmer Roundtable. You made a comment about being able to be sustainable, and then you also made a comment about being able to buy cheap food to be able to get it through the food chain, through the line, to be able to deliver it to the cities. I think one of the things that's very important to remember that farmers need to be profitable along with everybody else. If they're not profitable, then this whole business is not sustainable.
Maybe I'll just ask you, Mehmood, to respond to the first three. Were all directed to you.
Which order?
Your choice.
Yeah. The first one from my physician colleague. I think it's going to take an understanding of taking a look, first of all, starting with our staple crops. What are we actually growing? And does it have the mix of nutrients that we need? Continue that through. And our processing technology, and one of the things that was an aha moment for me when I went from healthcare, pharmaceutical industry to food industry, is processing food today is about adding heat. Everything we do to food is heated up to various degrees. And yet, if you ask any food technologist or food scientist, heat is the enemy of many of our micronutrients. And yet, why do we heat? We heat to desiccate, dehydrate, and by dehydration, it increases shelf life. At the end of the day, most cultures will use heat and dehydration as some way of preserving their food to be able to consume it after their harvest. Keep that simple thing in mind. And you tell me that we don't have the technologies or we don't have the ability to develop technologies that could get around that? How do we go from heat extrusion to supercritical carbon dioxide-based extrusion? By the way, I didn't know a thing about this until my engineers told me. But if I can invest behind that and lower the temperature, adjust the pH, there's a number of levers we can do. We'll change the supply chain. That was the first question. What was the second question you want me to touch on? Refrigeration?
Yeah, I think it's the balance between what's required globally in terms of food.
Yeah. You know, it's interesting let me be provocative, and if you talk to my staff, they'll tell you I'm never shy of being provocative. You know, we have some choices to make. Some of them are very fundamental. Let me give you a statistic. Somewhere just over 40 million hectares of arable, high-quality land on the planet today is used to grow tea, coffee, chocolate, and palm oil. 40+ million hectares. Tea, coffee, and chocolate. If you had to choose as a country between feeding your people and growing one of these cash crops, who should make the decision? Is it about increasing land use, or is it making choices of what we're going to use our precious resources of land and water? I'm not trying to judge one way or the other, but these are examples of choices we can make. Can we use corn and convert it to fuel, or do we want to use that same land and grow it for vegetables? It's a choice. Does our Department of Agriculture want me to grow corn and sell it, or do I grow broccoli? Now, I know if you're President Bush, that's not palatable, but you can make that choice. So some of this is really about choices, and I don't have the time to go through it, but I can go through line by line through the supply chain and give you examples of where we make these choices. Ultimately, I'm convinced it cannot be based on the choices we've already made and scale those. Now, the third question was around refrigeration technology. Look at the beta point. The first point for me when I commissioned this project was to make sure we went out of the box. So we went to our traditional suppliers and said, could you find us a way of making a refrigerator a third of the cost? Wasn't any surprise when procurement came back and said, no supplier says it's possible. Well, of course not. If you go to the usual suppliers, how are they going to tell you they can make the same thing for a third the price? I'm no MBA, but it sounds sort of like a poor business model. Now, the other way is I took a group of engineers who were not the traditional Ivy League engineers, but we took one good leader who actually wasn't an engineer, he was from our operations department, sent him to India and put him right in the heart of the engineering institute's ecosystem in India, where they know something about reverse engineering and low-cost engineering, because as an ecosystem, as a country, they've had no choice but a necessity to figure out low-cost ways of doing things. I bet you if I went to Africa, they'd have ideas. And my point is, first start, do not assume your arrogant position that because you have high institutes of education in one part of the world, that all the best brains and ideas come from there. We learn those applications. The second is take some of your smartest people from this part of the world, put them right there in an ecosystem that thinks differently, and that combined thinking will come up with ideas. Now, how are we going to scale this up? I don't know yet. First thing was, was it even possible? I shared with you that they showed it could be done. The second was, as I said, the idea actually came from electrical engineers, not refrigeration engineers. The electrical engineers were using these types of technology to lower the temperatures of their processors. I wonder if we could use it for food. Could we scale it? Yes, but maybe the manufacturing base is going to be a very different manufacturing base than what we might have gone to in the past. Or we've just transformed an existing manufacturing industry who's got an installed base of capital that may or may not be applicable. These are some very critical thinking as we think about scale-up. And the last point is, of course, who's going to provide the capital? Because what you're actually asking for is write-off of one type of capital investment and creation of another to change the operating costs of all of that. So I hope that at least gives you some insight into the thinking.
Thank you. We have 2.5 minutes, so if you, for those last 3 questions, I think if you can just quickly say what they are, it's going to have to be very fast.
Very quickly, to the Minister of Agriculture as well as to Dr. Khan. I'm an alumni of PepsiCo and now working for the Minister of Agriculture in Nigeria. How do we attract PepsiCo in terms of investing in the staple crops that we have made high priority in Nigeria? And to the Minister, how are you attracting investors and multi-corporations to come to your country?
Please.
Hi, my name is Carrie Kissler. I'm a student at Iowa State University studying these issues. My question's for the entire panel. What sort of advice do you have for someone like me or my peers about what we can do to help?
Great, thank you. Last question, really fast.
Thank you, that's a great one. Jennifer Rigg with 1,000 Days, which we've heard about, focuses on that pregnancy to age 2 critical window. So my question is, over the next year, what can we do in terms of tangible steps to ensure that our work to scale up nutrition is reaching that critical, cost-effective window? And in particular, which things would you each like to see happen in the coming year that we could report back on at the next World Food Prize? Thank you.
That's a big question. We need a panel on that one to do, but 1,000 days is top of everyone's priority, I hope. But we have really just time for, about 20 seconds each of the panel members just to address the questions and say any final thoughts. So I'll start with you, Minister.
Yeah,
Very
Marc,
just a
I wanted to
soundbite.
take one which was very interesting. The young lady on what can you do to help? You just did it. You're right here. And you've listened to the dialogues. The biggest challenge in agriculture is the human capital component, the ideas, that can drive new innovation, that can understand the local needs, bring that together, and it really starts with the human capital. Because again, I started with, I'm a farm kid. The farm kids are not growing. The small farms are starting to collapse. So we need more people like yourself that are here and interested and that'll jump in, pop the bubbles and pop the bubbles of other people, bring them together. So you've already taken the big step. Now the question is back to you. Now hearing what you're doing, how are you going to get involved? What part of the industry will you take up? And how will you move that forward from a leadership perspective? Because we need that leadership, we need that thinking, and we need the passion. The passion is the most important thing. As a farm kid, I had the passion to get there. I know it's going to be difficult, but to work all together to try to do it. So make it happen. I'll challenge you back.
2 last sound bites.
I guess my sound bite would be, you know what? For the leaders in this room, make it easy to take risks. One of the biggest problems we have is our anxiety and fear of failure. And yet, there has never been a great idea that's broken through without a history of a series of failures. My resume is made up 90-some% of failed ideas with a few successes, none of which were my ideas. I usually tell my students, I've made a career out of recognizing other people's ideas and letting them have a chance. And you know what? Maybe let's go back to that. It's political risk, financial risk, technical risk. We've got to learn to take the risk if we're going to move forward, because without it, there's no progress.
Great.
One of the great things about these conferences is that you get to meet other people, and I was at a great table last night purely by accident with the Future Farmers of America, and it was just a really great group. And one of the people I was speaking to basically said that their overall mission in working with young people is first to increase awareness about what they can do, then get them engaged, and then turn them into advocates. And I thought that was a great way to describe to young people, and we support a lot of these student groups as well, to young people what they can do. So increase awareness, get engaged, and be advocates. Thank you.
Great. Well, thank you. It's been a great panel, and give you a good round of applause. I mean, I do think there's a lot of optimism, I think, came out. There's a lot of new models that we can try, and I think the last message is about taking risk, and trying them, and let's not be worried about failure. A lot of these are proof of concept. So thank you.